At Francis Mahon Deaconess Hospital in Glasgow, leaders say providing healthcare over a service area of thousands of square miles comes with challenges.
We're the most geographically isolated community of at least 1,000 people in the contiguous 48 states. That just creates a lot of challenges with shipping supplies.
CEO Nick Durkis says they've also been dealing with an aging population and a smaller workforce. So when he heard the federal One Big Bill would include a pot of $50 billion to boost the quality and availability of rural health care, he took notice.
I think this is a generational opportunity to make meaningful improvements in the way we deliver rural health care.
Montana, like other states, initially made its plans expecting to receive $200 million a year, but the state will be able to adjust its proposals upwards after the federal government approved it for much more, $233 million in the first year. That's the fourth most in the country, with only Texas, Alaska, and California receiving more.
I think first it does speak to the strength and quality of the application that the Gianforte administration submitted. Also, I think it has to do with the massive size of the state and the large amount of our population that lives in rural areas. And so, that's where the challenge is how do you provide that health care? How do you keep these facilities sustainable?
The funding will continue through 2030. State leaders have said they'll use it for boosting the workforce, investing in prevention, expanding use of technology, and strengthening rural providers.
I think the application from the state stated that 89% of our rural hospitals have a negative operating margin. This is something that just isn't sustainable over the long term. So we have a tremendous opportunity here.
Durkis says he's still waiting for more details about the specifics of how the state will allocate the money. He says he sees some obvious things to work on, like expanding the availability of telehealth. But he says everyone looking at ideas will need to make sure they're ready to go for the long term.
We are getting this one-time infusion, but it is one time, and so whatever we do, we need to be able to sustain it into the future.
In Helena, Jonathan Amberian, MTN News.